In 2021, the federal government reported 7,560 people had lost their lives due to a toxic drug supply. That's an average of 21 deaths per day, compared to 8 deaths daily in 2016. On International Overdose Awareness Day, August 31st, RNAO spoke with people who have experienced the impacts of addiction. We also heard from RNAO's president, Dr. Claudette Holloway, and Canada's newly appointed Chief Nursing Officer, Dr. Leigh Chapman.
We have had overlapping epidemics. If you think of the overdose crisis and the COVID-19 pandemic, and together, they have certainly made the deaths from overdose significantly worse.
Every life is important, and at RNAO, we certainly believe that healthcare is a human right. We know that physical pain, you can say you've got a broken leg, and people will have sympathy, but mental health has just as much pain. And we need to work with supporting care for those who have the opioid crisis.
I've had migraine headaches since I was 2 and chronic cluster migraine since shortly thereafter. When I was 13, I had a severe bout of scoliosis where 1 month I was standing straight, and 3 months later I was on a 97-degree tilt. They were afraid that my rib cage was going to puncture my lungs, so they authorized me for a back surgery. I had that at age 13, and my spine has been degenerating ever since. So when I was 16, I had the spine of a 70-year-old.
Austin was one of my 2 children, and both my children were adopted. He was 1 when I adopted him, and it was obvious that he had some issues with anxiety and depression and things like that as a result of fetal alcohol spectrum disorder. And throughout his childhood and early teens, we were constantly seeking out mental health supports for him because his trauma occurred before he was even born.
We found a pain doctor. That pain doctor actually seemed to genuinely want to help, but what it did was it created an opioid crisis within me. They were prescribing medication just to dull the pain. Anybody who deals with chronic pain these days will tell you that throwing drugs at the problem isn't the answer, but it was the answer for a lot of my life, where they'd throw OxyContin in absolutely staggering amounts at the individual with the hopes of dulling the pain.
And one of the places he gained support was in a special classroom, and unfortunately, one of the members of his class introduced him to a group of people who introduced him to meth, crystal meth. Within 1 weekend, he was addicted to crystal meth. He told me that it was the first time in his life, in spite of many medication trials, that he felt no anxiety. And so it was very, very difficult from that point onward to try to get him services to help him stop using even when he wanted to.
According to modern research, any physical pain is going to override that, and you're going to feel pain above that. So they're going to have to keep increasing dosages. Your pain's going to reach that level again. You're going to have increased dosages. You're going to get the pain back again.
How he ended up using fentanyl was, he told me that he went to get some drugs one day and his dealer didn't have any meth, but he said, you can try this. And Austin knew the dangers of fentanyl, but he told him, I would never do that to you, whatever. And so he unfortunately started using fentanyl, and told me that it felt like he was being hugged by an angel when the first time he tried it. He said it's the most amazing feeling he's ever had. And that's not unusual for people who've used fentanyl to say. But unfortunately, he knew it was causing him a lot of problems. And when he tried to get help and he wanted residential care, he was denied help at every residential center in Ontario because of his coexisting FASD diagnosis.
I was caught sleeping outside my building because I was so dependent on those drugs that I didn't know any better than to go into my apartment. I was actually tapped on the shoulder, and I was lucky I wasn't robbed or anything. I was tapped on the shoulder by the person who worked in the office and told, look, do you need help getting home? And I managed to say, yes, I do. They got the custodian to bring me up to my apartment. And it was there that I kind of was able to get into bed, and I think I slept for 78 hours straight after that.
God bless him. He actually was able to stop using fentanyl. He was smoking pot, which as a nurse I struggled with, but it was better than using meth or fentanyl. And he was sober for about 4 weeks. And then the night of his high school graduation, he had just turned 18. He was very happy. His girlfriend, who was only 16, was also struggling with fentanyl addiction. They decided to celebrate his graduation.
When my doctor wouldn't prescribe, the doctor that in that case who was prescribing the medication got pulled before the Doctors Association of Ontario and the collegiate board, and he was stripped of his license. So all of a sudden I had this huge opioid addiction and nobody to prescribe it.
And so that the following morning, his girlfriend, I found him in the basement, and he was without vital signs. And we were lucky that he was resuscitated to the point where he was in the ICU, but he succumbed two days later.
My mother had to come in and immediately find me somebody, and she was so desperate that she worked at a hospital, and she asked one of the doctors, would you please take on my son? And he did. I said, this isn't working, I'm not getting better. In fact, this is making me worse. And he agreed. He said, yeah, you are getting worse. And it was a slow taper, but eventually I was tapered off of the medication. Well, I'm still on a fair number of medications, but nowhere near the amount that I was on previously.
There's so much stigma around substance use and that it's somehow poor parenting or weakness. And I know that's not true. Austin experimented like many teenagers did and got, there was a history of addiction in his family, whether he was wired for it, whether it was, that he was just trying to belong. This can happen to anybody.
The one thing I would say is that unlike the health human resource issue or the issue that we're facing currently in terms of the nursing shortage, the issue of the overdose crisis is not an issue of health human resources. It really is an issue of policy, right? Policy imperatives that are needed to help support people who use drugs. And we've done a lot of work, certainly since the Public Health Agency of Canada started tracking this 6 years ago. But of course, the deaths continue, so there's always more work that could be done. As I mentioned, I still do work in a supervised consumption site, and I think that that work has been very humbling for me, and they are most deserving of healthcare. And I think that when we look at our healthcare system, if we are able to think of those who are unhoused, who don't have access to resources, who are really adversely impacted by social determinants of health. And if we were to design the system for those folks, we would actually have a better system for all Canadians.
Well, these supports need government funding. The government needs to show that they're investing into all Ontarians. And definitely we need funding for the resources to set up these safe injection services, safe injection sites, so that people can obtain the help they need where they need it, wherever they are in Ontario. We would like the government to fund the urgent need public health sites where individuals, who are experiencing this mental pain can receive support and help to manage the difficulties that they're going through.
And I'm a longtime member of RNAO, and also the mom of a young man who died as a result of opioid poisoning in 2020. He's the young man in the sunglasses down beside my shoulder. This picture behind me is a picture of people that have been lost to our opioid crisis, and it's really important, particularly on August 31st, for you to remember that substance use can happen to anyone, and substance use disorder can happen to anyone, and drug poisoning from just recreational or experimental use can happen to anyone. Our drug supply is poisonous, and we need to advocate strongly for harm reduction strategies to prevent these unnecessary deaths. Thank you so much for this opportunity, and I honor everyone who's working with this population.